Now look at this MCQ which has been asked in the anatomy theory exam, final exam in November 2023. The SinoAtrial node is situated. Here are your options. So textbook actually Chaurasia says SinuAtrial node. Okay, SinuAtrial node the textbook says. This is the spelling that the textbook uses. So now you tell me where do you think it is. Look at this diagram here. In the external features of the heart you would have actually read about the SinoAtrial node, which is somewhere here. Okay, let me mark it in a better color. Here I'm going to use yellow, let us say here. So somewhere here externally it is there. So SinoAtrial node is where? Is it near the inferior vena cava opening? Interatrial septum? No. Is it near the opening of coronary sinus? No. I think coronary sinus somewhere here opening, so not there. Then is it near the opening of the superior vena cava? So what do you think it is? Yes, it is near the opening of the superior vena cava. What the textbook says, Chaurasia, is this. So please read the textbook language. The SinoAtrial node is situated at the atriocaval junction in the upper part of the sulcus terminalis. So here you have this muscle band, right? Crista terminalis, which they have told here. This crista terminalis is creating the sulcus terminalis, that kind of a sulcus means what? A groove kind of a thing, right? So there in the upper part of that sulcus is where you have this SinoAtrial node. So you should know that the SA node is actually in the external features of the right atrium. When you read about the external features of the right atrium, let me show that here. That is where you will see this. Okay, so what does it say in exact Chaurasia language? Along the right border of the atrium, so this is the right border of the right atrium, there is a shallow vertical groove which passes from the superior vena cava to the inferior vena cava. So there's a shallow groove here, so which passes from the superior vena cava to the inferior vena cava. This groove is called as the sulcus terminalis. How is it produced? It is produced by an internal muscular ridge called the crista terminalis. Okay, and in the upper part of the sulcus there is the SinoAtrial node, SA node, which acts as the pacemaker of the heart. So did you get it? Textbook language is this, but MCQ language you have to say it is near the opening of the superior vena cava.